At a certain point, growth stops feeling like momentum and it starts feeling like drag. As a mid-sized team, your expectations get higher. Leadership expects more out of you. And you get more partners. You have more actions that you have to take with those partners, more individuals at those partner organizations to interact with. And of course, more organizations. You may even have more therapeutic areas that you're being asked to cover. And it's all a benefit and a testimony to the work that you've done thus far. All of that work has allowed your products to get to market, but your organization is at this tough point, this thrive or dive element. And unfortunately, because senior leaders don't quite understand how what you do in advocacy and engagement measures up in dollars and cents, they look at advocacy and say, well, if you're not impacting the bottom line positively, what are you really doing? That's where we find ourselves doing a lot of the work. Translating the work that you're doing in advocacy into measurement that makes sense for senior leaders and your CFO. As a mid-sized pharma, biotech, or med device company, mid-sized companies come with great opportunity, lack of bureaucracy at times, but that small company feel for a mid-sized team can also lead to challenges. Most recently, we worked with a mid-size med device organization, and specifically in the diabetes space. And as you might imagine, a team being asked to do a lot with a lot of organizations in an age when everyone is looking at cardiometabolic, type 1 and type 2 as major opportunities for their organizations. When we came alongside of this organization, they were a small but mighty team of 5. And in a space like diabetes, 5 is not nearly enough to do it right. It's even harder when it seems like your own organization is fighting you every step of the way. But with our assistance, this team went from straggling organization in our benchmarking research to the market leader in just 2 years. Amazing, amazing work. But you see, when you are in that role at a mid-size organization, advocacy can either thrive or barely survive. The difference is, how do you show up? How do you represent your work? And who do you have to partner with to show senior leaders how to do it the right way? Benchmarking data, like our Elevate report, is extremely valuable for those mid-size organizations. Yes, you can't expect that in the overall report of all respondents that you're going to be at the top. But when we start looking at the therapeutic area breakouts, that's where organizations like those in the mid-size tier really shine. That's where you start seeing them break away from the pack of those who are resting on their loins and think that they've got it all figured out versus the scrappy ones that are still getting after it. And I'm so proud of this team that we worked with. The internal struggles were like yours, in which no one understood what they did, no one gave them credit for that work. Better yet, they saw them as doing nothing but showing up for conferences and happy hours. That's truly what was said. You and I both know that that's not the only work that gets done in patient advocacy. That is very important work when it comes to building trust and building relationships. Yes, you got to be there. But at the same time, it's doing that translational work and transformational work for the patient community that means everything at this point in your organization's growth. But so does structure, and so does process. And that's where having, again, 2 to 4 more team members on your organization when working with a company like mine at ARCO can help separate you from the crowd. We're able to come alongside of you. I've already discussed the Advoscape, but the Advocacy Intelligence Exchange is another opportunity to prove to your partners in nonprofits of patient advocacy, professional societies, and community-based organizations that you mean what you say when you're telling them that you want to be the market leader when it comes to partnering with them. What an Advocacy Intelligence Exchange looks like is like potentially what you may be doing as you think about advocacy advisory boards. but we do them a little bit differently. We see them not just as an opportunity to take from the community, but as an opportunity to serve at the same time. And no better opportunity to build relationships and build credibility by ensuring that your senior leadership is in attendance. One of the leading indicators in the Elevate report in the section of corporate reputation is, does your leadership provide access to nonprofits? We know that at many organizations, they don't. But that is what this company did differently. Their CEO was out in front, working with them hand in hand in patient advocacy, showing up at all of the meetings, showing up when they didn't think he was going to show up, and working hand in hand with them to serve, both literally and figuratively, that patient community. It was that work, along with ensuring that they worked with senior leaders in the executive leadership team to define a single point of contact model, meaning advocacy takes the lead. If anyone wants access to the professional societies, the community-based organizations, or the patient advocacy organizations, they were going to have to go to patient advocacy first, because those are the folks that had done the work for years of developing deep relationships, and they knew who were the right people to go to. So there was no more medical doing end runs around advocacy to try to recruit for a trial or a study. There was no more marketing teams going and running around the advocacy function, trying to get a patient story here or there. It was a top-down mission assignment from the executive leadership team to the entire organization that if you were going to go to the patient community, you went through patient advocacy. And it was one of the proudest moments of my career, getting that implemented at this organization. But it doesn't stop there. I referenced how they moved from 7th to 2nd in 2 short years. Again, coming alongside of that organization and understanding and going through that data section by section by section and identifying what were the 2 to 3 new tactics they were going to deploy and how were they going to deploy them and with what partners, through effective advocacy landscape analyses with our Advocate, and by bringing folks together around a shared table with a shared mission of health equity with our Advocacy Intelligence Exchange, allowing us to do the deep work that truly mattered to these partners, and it changed the paradigm of who the leader was in diabetes. It was no longer Big Pharma. It was a mid-size med device company. Congratulations to those folks on that team. And if you find yourself in a mid-size organization patient advocacy function, and you want to make sure that your team does things differently and that growth doesn't begin to feel like a drag, reach out to us at Arco Advocacy and shoot us an email at elevate@arco.io, or check out our website at arco.io, archo.io. Thank you.